So my primary role is to assume and execute the team leadership responsibilities and coordinate the ISAP work with the rest of the PBS program, the Protecting Best Services program work, as well as other colleagues and other interventions by other donors.
My role in ISAP 2 is the team leader for the World Bank for the Program for Basic Services, which is linked to ISAP. I'm also the sector leader for Human Development, which includes the PSNP program, and ISAP will be linked as well in the future to PSNP.
I'm the co-chair of the Transparency and Accountability Donor Group.
Relationship has gotten better, and part of the improvement in relationship may have been due to the change in leadership at the management agency. But also, I think the way the management agency functions internally, especially the Ethiopia part, has improved a lot. And I think on our part, having more of a hands-on operational person as a focal point has also helped.
The way it has worked under ISAP 2 is working very well. It does help to strengthen the independence of implementation of social accountability.
Where they overlap, they can closely work together, jointly conduct workshops, they can do trainings, citizen trainings together. They can also, for example, use similar training manuals.
ISAP and FTA can collaborate in the way they are delivered to the citizens through joint interventions, through joint missions, through joint awareness programs, and other things like that. But in terms of dialogue, at the federal level, there is also potential to build a coordinated response.
They are all trying to improve the quality of services at the local level. If the money is spent improperly, then the facilities will not get the resources they need, right? So they're looking at the financial information, how the local government spend the money, and then trying to train, and then at the institutional level to improve the quality of use of the money. They're all two sides of the same coin.
Social accountability can be sustained through enhancing the capacity of the SACs, engaging the SACs more, and using, for example, community-based organizations such as youth association, civil society such as youth association, women association, the ITER, different committees also, water committees. There are also other committees, health committees, for example, parent-teacher association.
There is increasing government ownership of this in terms of results and how it works. But I think it's going to be a long time before the government actually finances this. So I think in the medium term it will need external support to keep going. And while we're getting the external support, we should be building up the capacity of the Ethiopian NGO community, which, as you discovered, is not as strong in managing and implementing these things as in other countries. So
I think that implementation of social accountability will continue to involve a lot of research work and analytical work to learn lessons, to document experiences and good practices. You need, first of all, to build a critical amount of awareness among the citizens for this program to be implemented sustainably, and for the program to continue even when the current financing from the project stops. Continuity in implementation of ISAP in the medium term, together with documentation of lessons, together with setting priorities through a strategic plan and implementing those two, then we should be able to find a way of institutionalizing social accountability.
Well, we'll keep supporting this technically and hopefully trying to help generate funding for it.